Hello everyone, my name is Justin Kampf. I am the fitness lead at Sequence. I hold a PhD in exercise and health sciences, and I focus on helping people to become more physically active. Today we're going to talk about injury risk and prevention in strength training. First, we'll cover different categories of injuries, specifically acute versus chronic injuries. Then we'll look at different styles of strength training and associated injury risk and also prevalence. We'll also cover what causes injuries and then what can you do if you have an injury. Now, as a note, I'm not a physician, I'm not a physical therapist. I do have years of training experience where I've worked with injured clients, so individuals with various different injuries. If you do have a nagging or long-lasting injury, I think it's always a good idea to see a physical therapist or a physician. I know in the past I've had some nagging injuries specifically related to nerve injuries, and I've seen physical therapists and they've been able to shed some light on that and give me exercises to actually clear up that issue. What I will say is that oftentimes some rest and then also overall reductions in training volume is going to be a good idea. And I would say that a bad idea is to avoid movement completely, as this can really result in deconditioning, muscle atrophy, fear avoidance, and then subsequently a greater risk of reoccurring injury. So let's start out with defining different types of injuries. Specifically, we'll look at acute versus chronic injuries. Acute injuries happen suddenly, such as when a person falls, receives a blow or a twist, whereas chronic injuries usually result from overuse of one area and gradually develop over time. Now, in strength training, and a lot of this information that I'm about to give you comes from an article titled An Overview of Strength Training Injuries, Acute and Chronic, and this was published in Current Sports Medicine Reports. So acute injuries occur with rapid onset and are usually secondary to traumatic events. And these sudden injuries typically account for 60 to 75% of injuries in strength training. Typically, these acute injuries are strains or sprains, so these account for about 46% of injuries. And actually, the next most common mechanism is dropping of a weight. I did have one instance back when I was a college strength and conditioning coach where an athlete was pulling a weight off of the squat rack, and there was a 45 and then a 10, and he didn't realize that there was a 10-pound weight right there, and he pulled that off, and the 10-pound weight dropped on his foot. Always look out for that. It is not fun to drop a weight on your foot or pinch your fingers in between plates. None of those are fun. So what their studies suggest that of these weight training injuries, free weights account for more than 90% of the injuries. So this makes sense. Machines are pretty safe. I don't often hear of individuals hurting themselves or having these acute injuries while using machine-based exercises. So acute injuries can be further subcategorized into non-emergent and emergent types. Emergent injuries include acute herniated disc, fractures, and things like dislocations. Whereas non-emergent acute injuries are things like mild strains and are the most common and often do not stop an individual from continuing, but they might result in some kind of brief break from lifting. So either you can keep going with it or you might need a break. So the most common acute injuries are these non-urgent injuries, and they're usually muscle strains, ligament sprains, and they account for about 46 to 60% of all acute injuries in strength training. And these acute injuries in strength training usually result from a loss of control of the weight during positions of vulnerability. So maybe where your joint is in a compromised position and then you end up losing control. Chronic injuries are the result of repetitive stress being placed on the tissue that has insufficient time or recuperative abilities. Chronic type injuries tend to be of the overuse in nature, and account for about 30% of injuries associated with doing strength training. Tendinopathies, so a broad term encompassing painful conditions occurring in and around tendons in response to overuse, are the most common chronic injuries to be encountered, and they account for about 12 to 25% of all strength training injuries. Now, there's different ways to do strength training, and this is going to matter for what kind of injuries you are going to be susceptible to. So strength training is the broadest category of training, really anything that's designed to make your muscles stronger. But people often train for specific purposes, whether that's for performance in a specific exercise or in a specific group of exercises. So maybe you really want to get better at a bench press, or people do it for muscle growth if your goal is to get bigger muscles. And people also engage in strength training for health and also sports performance purposes. One question I was asked regarded functional training and injury risk, so I'll cover that briefly. So functional training is a bit of a catch-all term, but the definition is going to be training that attempts to mimic the specific physiological demands of real-life activities. The American Council of Exercise defines functional strength as this. So functional strength training focuses on exercising several muscles and joints together rather than working a particular muscle or group of muscles independently, resulting in an individual being able to perform daily activities with greater ease. And so this definition would definitely contrast with another form of training, which is bodybuilding, where specific muscles are trained for the purpose of increasing muscular size. So with this in mind, let's get into specific types of training. Now, types of training are generally going to include weightlifting, powerlifting, bodybuilding, strongman, and CrossFit. And even if you are training for a general health purpose, you're probably trying to do some kind of almost watered down version of this, whether I'm trying to get stronger. That's a little bit closer to, powerlifting or strongman or even weightlifting. Weightlifting might be if I'm trying to become more explosive. And if I want to be more conditioned, maybe that's more in the realm of a CrossFit or conditioning style type of strength training. And if I wanted to put on muscle, that's going to be more in the form of a bodybuilding type of training. So weightlifting requires the lifter to lift maximal loads for one repetition in two exercises. It's going to be the clean and jerk and also the snatch exercise. Powerlifting is similar to weightlifting in that we're trying to lift a heavy load once. So in this case, lifters attempt to lift maximum loads in the bench press, squat, and deadlift. So the order of events is squat, bench, and then deadlift. The individual has 3 attempts to lift as much as they possibly can. They can technically go for a 4th attempt if they're going for a state or a world record, which I've never personally been able to do a 4th attempt. Strongman events utilize a variety of heavy implements. This could include stones, it could include flipping tires, dragging cars or sleds. These events are timed, where the winner is the fastest athlete to complete the task. CrossFit athletes, essentially their competition is the CrossFit Games, where the winner is the athlete who completes, it's called the workout of the day or the WOD, in the shortest period of time. And bodybuilding actually has nothing to do with how much weight an individual is lifting. These people are essentially gauged on how symmetrical they are, how big their muscles are. So it's not a performance. While they have to use weightlifting, their competition is not weightlifting. It's how they look. These routines are going to have different training volumes, rest periods, and then in some cases different exercises. Although most lifters are doing relatively similar moves to different magnitudes or different extents. For example, a powerlifter may focus exclusively on the squat because that's what they compete for, whereas people training for different things may use the squat to help with muscle growth, or maybe a bodybuilder, or to help with their competition. So if I'm an Olympic weightlifter, you're probably going to be doing exercises like the squat, even though that's not one of your competitive exercises. In terms of common injuries in these sports, and we might be able to extrapolate this over to whatever your goals are. But remember, these are a little bit extreme. Most people aren't lifting to a 1-rep max like what would happen in powerlifting. And while you might want to get strong, maybe your goal is not to bench press 200 or 300 pounds or to squat 400 pounds. So in terms of common injuries, powerlifters more commonly injure their shoulders, while weightlifters are more likely to injure their elbows and knees. Both powerlifters and Olympic weightlifters seem to experience low back muscle strains at a higher rate than bodybuilders, so those people that are trying to build muscle. However, most of these injuries are not severe and require very little time away from their activities. I'm going to talk about the next study. It was actually a review. It was titled The Epidemiology of Injuries Across Weight Training Sports, and this was published by Justin Keogh, and this was in Sports Medicine. And what the author found was that those people that were engaged in weightlifting, powerlifting, and strongman athletes experienced a greater rate of acute than chronic injuries, so you're more likely to have an acute injury than a chronic injury. And for each of these different activities, I'll list some of the most common injuries for the sport, and this is going to be in descending order. So for weightlifting, the most common injury was strains, then sprains, and then tendinitis. Powerlifting was strains, tendinitis, and then arthritis. Bodybuilding was strains, tendinitis, and then cartilage degeneration. And strongman was muscle strains, tendon injuries, and then ligament sprains or tears. So a strain is trauma caused to the muscle. A sprain is an overstretching of your ligaments. Tendinitis is going to be inflammation of the tendons. Arthritis is swelling and tenderness of the joints. And cartilage degeneration or osteoarthritis occurs when the cartilage that cushions the ends of the bones deteriorates. So in the three sports in which competition and training performance is going to be based on heavier loads, so your powerlifting, Olympic lifting, these people have strains as the most common injury, whereas in contrast, bodybuilders who typically train at a lower percentage of their one repetition maximum, they're training more in moderate intensity ranges, experience a lower portion of muscle injuries, but they report a greater proportion of cartilage and then also tendon injuries. So these results suggest that greater loads used by powerlifters, weightlifters, and strongman athletes predispose them to higher proportion of acute type muscle strains and injuries. But the greater volume of exercise performed by bodybuilders, so volume is going to be reps times sets times load, they accumulate a lot of volume because that helps with muscle growth. These individuals tend to produce a greater proportion of chronic type connective tissue injuries. So how prevalent are injuries? So injury rates in weight training have historically ranged from, we're going to call this 2.6 to 11.9 injuries per 1,000 training sessions. You'll hear later, I'll call this training hours. So these injury rates are actually lower than other sports. So one study, which is titled The Epidemiology of Sports and Exercise-Related Injuries in the United Kingdom, basically indicated that 95.7, 64.4, and 62.6 injuries per 1,000 occasions of participation in rugby, soccer, and then hockey respectively occurred. So higher injuries you'll see than in other types of weightlifting events. So for CrossFit, a recent study in the Journal of Strength and Conditioning Research found an injury rate of 3.1 per 1,000 hours trained. So this is actually significantly lower than that in sports. But what they did find was that of their 132 respondents, almost 75% of them did report some injury at some point. So I think that this is a relatively natural aspect of being physically active, is that you might sustain some kind of acute injury. Research also suggests that most weight training sports have an injury rate of 1 to 2 injuries per athlete per year and 2 to 4 injuries per 1,000 hours of training with competitive exposure. And the majority of these injuries reported in these studies were of minor or moderate severity, and they affected the shoulder, low back, and then also the knee. In CrossFit, in that study that I was just mentioning, the most common injuries were at the shoulder, followed by the spine. Now, in terms of incident rates for general population, where I think that this might be the most comparable to functional training, I did find a recently published study in BMC Sports Medicine in the Medicine and Rehabilitation Researchers section. This study was published in 2022, and the researchers looked at individuals using the Freeletics body weight app, and they examined the incidences of injuries, and the study found that 24% of participants had an injury during training in the last 9 months. And the injury rate was calculated as 4.57 per 1,000 training hours. So less severe injuries such as strains were the most commonly reported. This seems pretty common in any kind of muscle strengthening activities. And this was at 28.5% of injuries were strains. Other injuries were muscle injuries, tendinopathies, and ligament sprains. These were the next most common. And severe injuries were rarely reported again, so most of these are of the acute nature. And the highest proportion of injuries occurred with burpees, the burpee exercise. This was followed by push-ups. Lower limb injuries were associated with lunges, sprints, pistol squats, that makes sense, and high jumps, so things that were a little bit more explosive or unstable in nature. But half of these injuries were actually resolved within a week. So again, they were acute injuries. So in terms of prevalence across different modalities, these numbers are going to be relatively similar, although it does seem that sports are actually more dangerous than general weightlifting. So what causes injury? So I would break this down into several different aspects. So it's going to be position, protocol, and inappropriate progressive overload. And another important thing to consider is, so when you're lifting, you have external loads. That's, how much weight am I lifting? How many reps am I lifting it for? What's my technique? But there's also internal training loads that are important to consider, such as nutrition, psychological health, current training status, genetics, and also the environment, because these may also affect training outcomes and potential injury risk. So resistance training related injuries can occur with movements of extreme internal rotation of the femurs, with external rotation of the tibia, or when there's a large anterior displacement of the tibia. So think about it this way: if you're doing an exercise like a squat and your knees are caving in, or if you're experiencing some rotation around your tibia, or if your knees are going too far forward under load, this can predispose you to injury. So this is just essentially an example of don't add heavier loads on top of poor technique. In terms of some upper body exercises, some positions, you might not be able to see this completely, but it's called, looking this way, the high five position. So this is essentially if you were going to put your hands up like, oh, you're scoring a field goal. So the end range high five position, this is when your upper arm is at 90 degrees abduction and elbow is at 90 degrees flexion. This is a high injury risk position. I'll lean this way so people can see this. So if you're doing shoulder presses where your arm is out like this, or if you're bench pressing when you're out like that, that's a potentially injury prone position. And this points to the importance of technique. In fact, the first thing that I look at whenever someone is experiencing pain is actually their technique. Many times it's not the exercise that's bad, it's how somebody is doing the exercise. For example, in some cases, knees traveling over the toes, or especially coming up on your toes during a loaded squat, can cause pain. That would be, it's not the squat's fault, it's that your knees are coming over your toes, you're unbalanced. And same thing with exercises like the deadlifts, Romanian deadlifts, or squats, where if somebody is experiencing flexion, lower back flexion under load, that can be problematic. So poor technique under heavy loads or also under conditions of fatigue should be avoided. One paper that I wrote this year, which was published in the American Journal of Lifestyle Medicine, focused on low technical demand exercises for novices. This was important because starting with low demand technical exercises can ensure that people avoid poor technique under heavy load. Again, if not very challenging technical exercises might include machine exercises. Again, I said 90% of weight training injuries come from doing free weight exercises. This is not to say you shouldn't do free weight exercises. It's just to stress that these exercises are a little bit more technically demanding, so it's important to not really push load until you get technique down. Now, in regards to injury, we need to avoid the combination of high loads, several repetitions, and fatigue in maintaining unfavorable positions, as this can generate undue stress on the muscles, on the joints, on the ligaments. So progressing is going to be incredibly appropriate. So not only how much weight are we lifting, and specifically are we using good technique, but how are we progressing weekly? There's a principle in running, it's called the 10% rule. And it states that you should never increase your weekly mileage by more than 10% over the previous week. And I think that we can apply this to strength training too, because increasing volume too much too soon can greatly enhance an individual's risk of injury. High weekly volume increases in training are associated with injury. So what we should do is we should shoot to not increase our overall training volume by 10% weekly. And again, volume is this combination of your sets, the number of sets you do, times the number of reps that you do, times the load that you do. So if I did a back squat for 3 sets of 10, that's 30, at 100 pounds, that's 3,000 pounds of volume. So it wouldn't be a good idea for me next week to go up to 6,000 pounds of volume, because that's doubling this. I want to talk about an interesting study from Sandro, I'm going to try not to butcher his last name, but it's Bartolome. And this was published in the European Journal of Applied Physiology. And this was actually looking at what's going on internally in different types of training routines, specifically a high volume training routine, which is more characteristic of bodybuilding style, versus a high intensity routine, which is heavy strength training, more characteristic of your weightlifting, your powerlifting kinds of training sessions. So the purpose of their study was to compare the acute responses of two common different modalities. Again, that high volume with moderate intensity. So if you're training at 70% of your 1 rep max, that's typically characteristic of high volume routines. High intensity routines usually mean you're training at a little bit lower volume because you need to rest longer and you can't do as many reps. And And what they did is they looked at performance recovery post-exercise in experienced resistance-trained men. And their experimental protocol consisted of a counterbalanced crossover research design. All that means is that one group did one protocol, rested for 10 days, and then they did the other protocol. So if I did the high volume protocol, I would have rested 10 days, then done the high intensity protocol. If I did the high intensity protocol, I would have rested for 10 days and then done the high volume protocol. So both resistance training protocols were comprised of the squat only. During the high intensity protocol, participants were asked to perform 8 sets of 3 repetitions at 90% of their 1 repetition maximum, and recovery time between sets was set at 3 minutes. During the high volume routine, participants were asked to perform 8 sets of 10 repetitions at 70% of their 1 repetition max, and their recovery time was set at 1.25 minutes. Now, during the high volume routine, what they noticed was that counter movement jump performance was significantly reduced for these individuals 30 minutes after the routine, 24 hours after the routine, and 48 hours after the routine. Versus for the high intensity, that's those people that were lifting heavier, their explosive ability, their counter movement jump performance was only reduced for 30 minutes after the routine. What they also noticed that was 30 minutes after the routine, cortisol, blood lactate, and IL-6, IL-6 is going to be a marker of inflammation, was significantly higher in the high volume group, 30 minutes after the routine, compared to the high intensity group. So the traditional, this hypertrophic, this muscle building based exercise protocol, it resulted in pronounced fatigue that lasted 72 hours post-exercise. In contrast, strength and power performances were completely restored 24 hours following the high intensity session, that heavy strength training session. There were significant elevations in blood lactate and cortisol concentrations, 30 minutes, which reflected, which we know this, higher metabolic stress with the high volume routine. Now, the quick recovery observed following the high intensity workout suggests that the same muscle groups can be trained more frequently. This can only be extrapolated to experienced individuals. So using that protocol, an individual that's doing heavy strength training might not experience as much fatigue, and this is actually called peripheral fatigue. They might not experience that much fatigue, and they may be able to train more frequently. In fact, you actually see people train for powerlifting that do heavy squats multiple times per week, versus this might not necessarily be applicable in more bodybuilding or muscle building routines because of that experienced soreness that the individual gets. So I want to wrap this up. So first, injury rates in strength training related activities are actually much lower than that observed in sports. Injuries associated with strength training or weight training have been attributed to inadequate strength or endurance, poor conditioning or technique. That's important. Make sure you have your technique down. Improperly selected resistance training exercises or the actual load that they're supposed to be doing. Loss of balance, insufficient warm-ups, and then also fatigue. We definitely do not want to be lifting with bad technique under conditions of fatigue. So it's important to make sure that you first have good technique and also monitor your overall training load to make sure that you're not increasing it too quickly. Most training modalities, so CrossFit, weightlifting, bodybuilding, powerlifting, and strongman, and I also included that body weight training study, have somewhat similar types of injuries. And most of these injuries are acute, meaning they don't last long, maybe about a week. Bodybuilding, so those muscle building routines, are associated with different types of injuries, specifically such as cartilage and tendon injuries, which may in turn become more chronic. For functional or body weight routines, exercises like the burpees or push-ups or other explosive movements are associated with injury. This is not to say that any exercise is bad, but these exercises may require some level of baseline fitness. So regressions at first might be appropriate. So let's not jump right into doing burpees or push-ups or really any kind of jumping movement until we've had some kind of baseline level of fitness. An important thing to remember, though, is that most injuries are not permanent and a natural part of the training process. How you react to the injury can influence the outcome. I would certainly encourage people to recognize when they're injured and frame it as this is normal. Again, people tend to have some kind of aches and pains or injury with strength training. It's normal but non-permanent. When you do have an acute injury, what you should probably do is Have at least a week of reduced training volume while still trying to move, so not necessarily being sedentary. Now, if an injury persists for a long period of time, it would be important for you to speak with a health professional, so a physical therapist or a physician, because they may have some fixes that you might not be aware of that could clear up the injury a little bit quicker than natural.